Welcome to this month's edition of the Academy of Online Radiology Education blog. My name is Dr. Gregory Obala from the Oregon Health and Science University. I prepared this with the help of Dr. Alba Duran from the Mount Sinai West. I would like also to acknowledge my senior editors who are Dr. Browning Hamilton from the OHSU, Dr. Orlando Ortiz from New York University, Dr. Mohanad Ibrahim from the University of Michigan. So we collected a couple of studies recently published on neuroradiology, and we thought these were interesting to present for you this month. So the first article I chose is on the recommendations for neuroradiology training during radiology residency by the American Society of Neuroradiology Section Chiefs Leadership Group. In this article, they summarize recommendations basically for training in residency and competency basically. So in this particular one, they recommend that every resident should have at least 16 to 24 weeks of training in neuroradiology under direct supervision of a neuroradiologist, and these they recommend to be in the latter half of the residency training. They also recommend that a certain criteria of numbers of studies should be met, even though this does not show competence per se, but at least bears towards competence. So they recommend at least 300 CT scans, 150 MRI studies, all neuroimaging, and 50 neurovascular imaging studies, both angios and of the CT angiograms and MR angiograms. They also recommend that competency in neuroimaging be tested through various means. They also recommend that those who do not meet these criteria should not be considered to interpret even routine studies. And then they recommend that for independent practice and interpretation of advanced neuroradiology, including pediatric neuroradiology, head and neck neuroradiology, and advanced neuroimaging, a formal ACGME program is recommended. The second article that we got was on spinal compliance curves. So this is titled Spinal Compliance Curves, Preliminary Experience with a New Tool for Evaluating Suspected CSF Venous Fistulas on CT Myelography in Patients with Spontaneous Intracranial Hypotension. So in this study, it estimates the craniospinal space compliance using intrathecal saline infusion during CT myelography, and explores the use of craniospinal space compliance and pressure volume curves in patients with suspected cerebral CSF venous fistula. Essentially, the craniospinal space is the CSF space in the brain and also in the cord. So during this dynamic CT myelography, 1 to 5 mL of saline was infused, and incremental changes of CSF pressure were recorded, and these data were obtained and put on plots of craniospinal space compliance curves. So there were 34 CT myelograms done in 22 patients, and these were analyzed. 8 out of the 22 patients had confirmed CSF venous fistulas. Patients with confirmed CSF fistulas had higher compliance at opening pressure and overall compliance compared to those who did not have that. There was no difference in the pressure volume index between the two groups. Preliminary analysis of craniospinal space compliance curves provides qualitative and quantitative information about the pressure volume dynamics and may serve as a diagnostic tool in patients with known or suspected CSF venous fistulas. This new other article is titled Prediction of Clinical Outcome in Patients with Large Vessel Acute Ischemic Stroke, Performance of Machine Learning versus Span 100. Span 100 is essentially a stroke prognostication tool that uses the National Institutes of Health Stroke Scale, the NIHSS, and age together to prognosticate outcomes in stroke. So this was a comparison of machine learning algorithms and Span 100 in outcome prediction for acute ischemic stroke. It was a retrospective study in which they used patient clinical examination, baseline CT imaging findings, and a 90-day modified ranking scale for neurologic disability, the MRS. it used extreme gradient boosting machine learning models to predict that neurologic disability in 90 days using clinical imaging combined and best performing features in 3 groups of patients, which were the full cohort, recanalized patient and non-recanalized patient. The baseline NIHS was the most significant predictor of outcome among all the parameters that were used, with relative weights of 0.36 to 0.69. Ischemic core volume on CT perfusion ranked as the most important imaging biomarker with relative weights of 0.29 to 0.47. The model with the best performing features had a better performance than other machine learning models. The area under the curve of the model with the best performing features was higher than the span 100 model and reached statistical significance for the total and the non-recanalized patients, which were both less than 0.005. The study shows that machine learning models trained with best performing clinical and imaging features, including advanced CT perfusion parameters, can predict the outcome of patients with stroke more accurately than a conventional stroke system such as SPAN 100 that was used in this study. This article is titled Spinal Dural Leaks in Patients with Infratentorial Superficial Sclerosis of the Central Nervous System, a refinement of diagnostic algorithm. So the aim of this study was to determine the frequency of spinal dural CSF leaks amongst patients with symmetric infratentorial superficial sclerosis, pattern seen on MRI. So this included both ISS type 1 patients who are described to be idiopathic, which means that we do not see hemorrhage at the time of the examination, but we see features of superficial sclerosis, and full examination with angiography studies of the brain are done, and still there's no source for the hemorrhage. And also in ISS type 2 patients, ISS type 2 patients are those in whom hemorrhage is determined at time of imaging, but there's no cause for hemorrhage. There's no mass, there's no aneurysm, there's no venous thrombosis. So this was a single center study conducted with a retrospective and prospective component. Retrospectively, they collected data from several patients who had superficial sclerosis in the image archiving system, and then the prospective arm was basically they looked at MRIs of the spine to look for dural basically a dural tear with a leak potentially in those cases which had superficial sclerosis. So patients with ISS type 1, who are those with a causative intracranial bleeding event in history, were also screened for dural CSF leaks if the etiology of the bleeding event could not be determined. So this was bleeding of unknown etiology. So there were a total of over 97,000 MRI brains in the study period, of which 93 patients were with superficial sclerosis and were recruited. There were 4 patients with ISS type 1, which I'll call idiopathic, and then in all these 4 patients, a spinal dural CSF leak was identified on MRI of the spine. All patients classified as ISS type 2, who are those with an unknown etiology of hemorrhage. One of them was found to have a dural CSF leak on a follow-up with the MRI of the spine. One of them was lost to follow-up, and 2 others did not have. So in a total of 7 patients in whom it was thought that there was no cause for their superficial sclerosis and they had symmetric infratentorial superficial sclerosis, there were 5 patients who were identified to have a spinal dural leak in these 7 patients, which is about 71% of the patients. So in cases of symmetric infratentorial superficial sclerosis pattern without bleed or identifiable cause for bleed, diagnostic workup should include magnetic MRI of the whole spine, basically, to rule out a dural CSF leak. This other study is titled Brain MRI Findings in Severe COVID-19, a retrospective observational study. So this study aimed to describe neuroimaging findings in severe COVID-19 patients, excluding ischemic infarcts and venous thrombosis. This was a retrospective multi-center study involving 16 hospitals, and 37 patients were recruited into this study, and their neuroimaging was reviewed, and a summary was made of 8 different patterns in which COVID-19 was thought to present. So 16 of these patients had unilateral flare or diffusion hyperintensities located in the mesial temporal lobes. 11, which is 30% of the patients, had non-confluent multifocal white matter hyperintensities lesions on flare or diffusion with variable enhancement associated with hemorrhagic lesions. 9 patients had extensive and isolated white matter microhemorrhages. 4 patients had extensive and confluent supratentorial white matter flare hyperintensities. 2 patients had flare and diffusion ovoid hyperintense lesions located in the central part of the splenium of the corpus callosum, and 2 of them had non-confluent multifocal white matter hyperintense lesions on flare and diffusion with variable enhancement. 2 of these also had acute necrotizing encephalopathy, and 2 others had flare or diffusion hyperintense lesions involving both middle cerebellar peduncles. 28 patients had one pattern, about 7 patients had 2 patterns, and 2 showed 3 patterns. So the majority of the patients had one pattern out of the 8 different manifestations of the COVID-19 in this study. Also, a comparison between patients with and without hemorrhage on imaging showed that those with hemorrhagic complications were more frequently associated with severe illness, which was in ICU admitted patients, patients with acute respiratory distress syndrome, and patients with pathological wakefulness. So that ends this month's presentation. This has been the Academy of Online Radiology Education. Thank you.